not one of the top 2 reasons. I'm sure it's in the top 20.
Performance, obviously.
Yeah, so power output will be related to
They have
performance.
the proper alignment.
Yeah, proper alignment, which will lead to
prevention.
yeah, injury prevention. Okay, so top 2 reasons for correct bike setup, same as running: injury prevention, performance optimization. What else is important in performance optimization, as well as having the right bike? Training load. That's right, Jess. Well done. What factors do we need to look at to complete a bike setup? And we're not going to do like a full-on workshop on bike setup because that's about a 2-day course and we don't need to look that in depth. But as exercise physiologists, what factors are going to change how someone sits on a bike?
Seat height.
No, yeah, so that's one of the that's a factor of the bike setup. Yeah. What factors of the rider is going to change how we set that bike up? So what's going to determine
condition? Condition?
So
kind of go from say a knee replacement to
yeah, definitely. So the level of the rider. So it could be recreational, it could be rehab, it could be sub-elite, elite. Okay? So obviously someone that cycles 500 kilometres a week is going to be set up very differently to someone who's never been on a bike and just wants to ride with their grandkids. Okay? What else will be important? You mentioned before an injury. So with the knee replacement?
Yeah. So to create flexion?
Yeah.
That's what I'm talking about.
Yeah, so range of motion. So what joints are going to be important in cycling to know range of motion?
Hip and knee.
Hip and knee. What else? Ankle. What else even more important?
Lumbar.
Yeah, lumbar. Yeah. Very good. Very good. If we can't sit, in this sort of position because we're tight or we can't move that way, we can't set someone up like that. Okay. What else influences lumbar spine?
Thoracic spine?
Yeah, thoracic spine. Yep. Yeah, and then looking at muscle lengths as well. So once we have that range of motion, what's changing it? Okay. We know psoas is going to be a big part of cycling, more so than running. Running is very much a momentum type thing. There's not a huge amount of psoas activation compared to walking, unless we're a sprinter. But with cycling, we do get a lot of psoas because of that lift up with the pedal. Okay. So usually the people that we see with the most developed psoas or the shortest, strongest psoas will be an athlete like a cyclist who has an office job where they see it all the time. Okay, so usually our recreational riders or our weekend warriors or our sub-elite, they'll present worse than our elite athletes because the elite athletes, as well as riding the extra distance, are going to be doing dedicated stretching programs and Pilates and regular massage and that sort of thing, as opposed to we smash ourselves on Sunday and then a sore for 3 days. Okay, so all that sort of stuff's important. Any injury history they've had as well, a range of motion is going to be important. Okay, so if they've had a left shoulder dislocation or an arthroscope on their right knee, or if they've had a dislocated hip, or if they've had a disc herniation, those sort of things are going to influence the position of our body on the bike. Yeah. Why might that be?
Or muscle length changes as a result of the injuries? Yeah,
definitely. So muscle length changes and muscle activation or strength, so their ability to stabilise. What else?
Pain.
Yep, pain. Yep. What if it was someone that had a disc herniation 5 years ago? How might that change where we want them on a bike? If we know that there's a
safe place over.
Yeah.
You can see on the extension.
Yeah. So we don't want to put old injuries under extra stress. What are common cycling injuries we get then? I've got a list of about 20. See how many you guys can get as professionals.
Low back pain.
Low back pain, yep. More specific?
So disc bulge.
Yep, disc herniations. What else? You guys should be able to reel these off really easy.
Lateral knee pain.
Lateral knee pain, yep. More commonly known as
PFJ.
Yep, PFJ pain syndrome.
Neck.
Yep.
Achilles. Achilles?
Yeah, Achilles, like tendonitis, tendinopathies. Yep. What else?
Is it tennis or golfer's elbow?
It's golfer's elbow with cyclists. Yeah.
So medial.
Yeah, medial epicondylitis. What else?
Can you get overuse in the safety band?
Yep.
Poor technique there?
Yeah, there's heaps of overuse that can be involved.
SRJ.
Yep, SRJ pain. Facet joint injuries, hamstring strains, ITB friction, knee meniscus, knee ligaments, calf overuse or calf strains or tears. What about upper body? What can we see with cyclists?
Upper track activation.
Yep, definitely, which will be involved in neck pain, like I said before as well.
Scalenes.
Scalenes, yep.
Flex position.
Forward head posture.
Forward head posture, yep, so all that yarn is up across. What else? So we can get like neuropathies, like an ulnar neuropathy. Okay, we can get rotator cuff injuries, we can get shoulder dislocations and instability. If we look at accidents, obviously there's AC joint dislocations and fractures. Impingement. If we look at triathletes, impingement's probably going to come a bit more forward as well. Okay, so what they do off the bike's going to be important as well. If they have to ride 50k or 100k, or like the Ironman in Melbourne the other day, they have to then get up and run. What's going to be important for their upper body? What's going to influence their run pattern?
Posture.
Posture, yeah. So what would be with cyclists? What would be a typical posture you'd see?
Kyphosis.
Yeah, kyphosis, yeah. And what about scaps?
No.
Protraction or
Yeah,
retraction?
protraction.
Yeah, perfect. Okay, so on this sheet is a resource for musculoskeletal screening for cyclists. Okay, so whether that's your recreational or if you're lucky enough to work with an athlete. Okay, and it has through all the stuff to look for postural assessments and that sort of thing. Okay, which is going to be very similar to what Ryan talked about already. You can go into more specific exams if you want it, so if you want to look at SIJ or if you want to do slump tests to check your nerves and that sort of thing. Alright, we might, Ben, do you want to down while we look at it?
Yep.
So,